Welcome back. Well, Gauteng has seen a massive spike in COVID-19 cases over the past few days. It's made up around 80% of all new infections in the country. Yesterday, it recorded over 2,000 over the country's 2,800 cases. So let's discuss this matter now with Harsha Somaroo, who's public health medicine specialist for the Gauteng Health Department. Thank you so much, Dr. Harsha, for your time this morning. I mean, looking at how the COVID-19 infection figures are looking, particularly for Gauteng, as public health, are you guys concerned around being able to manage the spread of the new infections?
Morning, Faith. Yes, in Gauteng, I think we are quite concerned with the rapid increase in cases over the past 3 weeks and especially over the past week. In terms of are we worried about how to manage it? I think after being involved with this pandemic for a year and a half, we know what needs to be done. It just means implementing these actions again for the fourth time. So I think really what we need to do at this point in time is emphasize all the preventative mechanisms we have in place. That we're lucky. This is the first time in any of the waves where we have vaccinations available in the country. So we really want to encourage everybody to make sure that you are vaccinated or boosted if eligible. And then in terms of the preventative mechanisms, these are critical at this point in time, ensuring that people avoid gathering when we know that there's this potentially incredibly virulent virus circulating amongst our midst. It is incredibly important to avoid gathering where possible, and then to ensure physical distancing and mask wearing when you have to be out in public, as well as adhering to the respiratory and hand hygiene. All of this is really going to be quite impactful.
Yeah, well, Dr. Harsha, what is causing the rapid increase in infections, particularly in the Gauteng province?
I think this week, with the genotyping results that were released and the detection of the now newly named Omicron variant in the province, this is most likely the main reason behind the rapid increase that we're seeing. However, despite the prevalence of any variant, if we manage to adhere to the preventative measures, we will manage to curb transmission. If people were not in contact with each other, the virus would not be transmitted. So we really have to decrease all possibilities for transmission to actually control transmission of this variant in the province.
Well, talking about the new variant, when did we come to actually know about it for the very first time? Because you're speaking about how we need to avoid large gatherings and social gatherings and being one. We come from a local government elections where we were encouraged to come out in our numbers and cast the X. We were encouraged to participate in an actively political environment as well. So if you're speaking about gatherings, many would say that it's a little bit too late to say do not gather, because we mandated it from a government perspective. We said, government says we need to vote, we need to go out, campaigns, political parties can campaign. So when we speak about these variants, when did we come to know about it exactly? Was it before local government elections or was it after?
So certainly after. I think when the decision to have the local government election was made, and when I think people were encouraging citizens to actually come out in their numbers to vote, they were doing this amidst very low levels of transmission in the province and in the country. Also, they were all encouraging people to adhere to the non-pharmaceutical interventions at all voting stations. So at that point in time, we were under different circumstances. This new variant was actually detected this week on Tuesday. I think the samples were from 10 days prior to that. So I think in terms of the timelines, it is quite close. We can't really say with all certainty where and when this variant actually arose. But I think the important thing is really to focus on now and what we're seeing and managing this best we can going forward.
Yeah, speaking about managing it as best we can, it's all about vaccinating, right? But do you think that, especially when it comes to government, have you managed to articulate the message around vaccination clearly so that even those that are vaccine hesitant may be swayed to actually put the jab on their arms? Because as we're speaking right now, we've got an oversupply of vaccinations. We've got vaccines that are close to an expiry date because they don't last forever. And we're seeing a low pickup in terms of the vaccination numbers. Won't be targeting as a Gauteng province around 130,000 or so, never mind about 300,000 as a country altogether. So how are we faring in being able to articulate a message around vaccinating and alleviating some of the fears that continue to exist?
Yes, I think from the government perspective, they have a really good vaccination program in place, and I think they're doing all they can. There's different reasons that people don't vaccinate. One is access to vaccinations, and I think from that perspective, the government, I can certainly speak from a Gauteng perspective, but I'm sure this is being done around the country. There's definitely been a lot of interventions to increase vaccination and to increase access, where vaccination sites have been taken locally to communities and to people and workplaces directly. So in terms of access, I think they've tried to manage that. The other problem is vaccine hesitancy due to misinformation. I think there's been a lot of rumors surrounding different side effects of the vaccine that have been circulating here as well. I think people have tried to address these when they've become aware of it. But I really think for things like this, government can initiate the messaging, but it's up to community leaders at all levels and really individuals to take these messages and share it amongst their family and friends. It's really, misinformation is a really big problem, and it reaches higher levels later, but I think on a one-to-one basis, we encounter people's views all the time, and we really need to assist and take some sort of responsibility to make sure that everyone in our midst, all our family and all our friends, are vaccinated. If people do have concerns, there's a lot of information available on the different websites via the different health departments. So I think they should be aware of that as well.
Dr. Harsha Somaroo, we'll leave it there for now. Thank you very much for your time. Public Health Medicine Specialist for Gauteng Health Department, is also part of the VIS School of Public Health.